We're almost live.
Sherry, if you can hear me, you can dial in without having to use your computer audio.
All right, Judge, I see we're live. You're muted, Judge.
I'm going to go ahead and call this Russell County Local Board of Health meeting to order Monday, February 8th, 2021. I want to welcome everybody for being on this meeting. I'm going to turn it over to Sean for the minutes of the last meeting. We need to deal with that first.
All right, Judge. Everyone should have had a full board packet sent to them prior to the meeting. And I'm going to, from time to time, I'll share my screen so that everyone can see what I'm looking at here. Let's see if I can. I've got too many windows open.
Okay. I'll put this phone on hold.
Okay, so let me share this. All right, you all should be seeing the agenda. And the first item on the agenda is to approve the minutes. And we had a meeting on February 3rd. These minutes should have been sent out to everyone. So if you have pre-read these minutes, I think the judge would be happy to entertain a motion to accept the minutes. This was for our regular meeting that we held on, what day was it? For our regular meeting we held on March 3rd. There's another set of minutes also you'll see that was from a special called meeting on April the 29th. And again, all this was forwarded to you guys in a packet before the meeting. And so the minutes are in your packet. And if you have reviewed those, you can make a motion to approve, I suppose.
John, that's February 3rd, that meeting, instead of March 3rd.
Let's see. February 3rd. Yes, sir. That's correct. I'm sorry. And
I'll make a motion to approve them. I'll make a motion to approve the minutes.
That sounded like Mickey Garner.
It was.
All right.
I'll second. Dr. Miles, I'll second.
Dr. Miles, second. All right. Would anyone care to have any discussion about the minutes? All right, Judge, is it okay to take a vote?
Yeah, they're all saying aye. It's in favor of passing.
Aye.
Aye.
Anybody opposed? Motion passes.
Judge, the next item on the agenda is for health education to give an update. So I'm going to scroll down to that part. Shirley is on the call. Shirley, do you want to give the report? I'll pull up whatever page you want to see.
Okay, I think we're okay. They have probably already reviewed their data, so I'm not going to go over a whole lot, but let me go ahead and just say thank you for giving me this opportunity, especially with health education. And every year you all are very gracious about letting me come and talk a little bit about what health education is doing, and I appreciate that. Our community health assessment for 2020, sometimes we call it the CHA, of course, is completed, and we were very proud that that is completed for our county. Our community health improvement plan, of course, is even though we have a lot of it done in Russell County and we had it done on time, it's kind of been put on hold because of COVID. It's made it very difficult to continue with community activities and, of course, plans, but we are planning on continuing that in the near future. We have moved forward, of course, with the ACEs, And for those that don't know what that is, it's adverse childhood experiences. This was a grant through Louisville, Kentucky, and through the Bounce Coalition. And here in Russell County, our school system has been on board with ACEs as well, with all their personnel being trained. And when I say that, that means bus drivers, teachers, and food service. We've had several people also too, all of us in health education that has been trained in that as well. And we want to move forward in that in the future as well. Russell County's Health and Wellness Coalition, of course, is very active virtually, of course. However, we're working on a campaign to pull in more active members, and we'd like to see more board members involved with this coalition. Some of you board members are very much so active, and we appreciate that. And if you want to have more information on that, of course, I'd be happy to share that. Just give me a call about our focuses in Russell County and also our goals. The coalition meets, of course, every fourth Thursday each month, and hopefully in the near future, we're going to continue to that meeting here at the health department. But as of right now, there is a meeting that I'll send out some information, and hopefully we'll be able to meet virtually, of course, in March. So you do have the data in front of you, just a quick snapshot. I won't go over all of this because you can look over this and digest it a little bit on your own, but I do want to look at some of the things as far as Russell County is concerned. And any of you all know that I'm very, very proud to be working here in Russell County as a health educator. But the Russell County population, I thought, has actually increased from 2015 to 2020, about 69 people. So thought that was pretty neat compared to surrounding counties such as Wayne County, which had a decrease of 210 people. So Casey County, of course, had a decrease of 179 persons. So, 69 doesn't seem like a lot of increase, but then when you compare them with some of the counties that are about the same population, it's quite interesting. Of course, we would understand that Taylor County, since it's a little bit larger, it would have a more increase, but it has about a 900 person increase. And of course, Pulaski County had an increase as well. We've seen a slow increase, of course, over the years in our senior population. And I am more aware of that as I get to be closer to that. And so this is just data from persons that are over 65 years of age, and about 1.5% was an increase in Russell County. And that was comparison to Kentucky. And Kentucky is at about 2%, which we're just right there, we're slowly increasing. And we need to think about that because they're increasing our senior population. We're seeing more people that's retiring. We see more people also too that are on Social Security, things like that, but also health costs a lot of times as you get older increases as well in our senior population. On a positive note, I feel like that here in Russell County that we have more seniors that once they retire that they do continue to work at least part-time, and some of them are working full-time. So, I'm encouraged about that. Household incomes, approximately $3,000 from 2015 to 2020. So that's an increase. We also have unemployment decreasing as well to a little over 4% here in Russell County. And that's compared to around 4% in Kentucky. So we're about the same as far as percentage of Kentucky. So feel like that's really encouraging. Of course, as most of you all know, I'm very passionate about adult smoking. And so adult smoking, as most of you all know, I continuously monitor this. Very proud of the report of adult smoking, which has decreased from about 31% in 2015 to 23% in 2020. Wow, that is a huge, huge success for Russell County and for our health of Russell County. So I'm really, really pleased to report that. We do have much more to work on, of course, as far as Russell County is concerned. We're going to start focusing on youth vaping. And that is something that has come up in the last few years, and we want to start addressing that more and being more aware of it, helping our community to be more aware of it, and especially with education. Just a couple more, of course, as you know, you have a copy of a review, and we want you to just go ahead and digest that when you have a time. But adult obesity is a concern for Kentucky, especially as we feel like that the numbers will probably increase because of the COVID. Kentucky adult obesity in 2020 was about 34%, with Russell County being about 32%. So now in 2015, Russell County was 32% as well. So there has not been a change in obesity in Russell County data. We'd like to see a more positive change in the next 5 years, especially with percentage. With that, because we all know that obesity, that it comes with lots of other health issues as well, such as heart disease, of course, diabetes, and numerous other health problems. So lastly, I wanted to address the excessive drinking. In 2015, it was reported as about 8% in Russell County compared to 2020, with an increase to 14%. So from 8% to 14%, that's a big jump. This is concerning, of course. However, compared to Kentucky with 17%, the percentage is lower as far as statewide. Of course, in conclusion, I must say that our health education department has been hard at work, especially virtual learning in many of our programs that have not been able to get into the schools, but the school system has been excellent in working with us to continue programs such as reducing the risk and making a difference. And we're offering that still virtually, of course, in middle school and of course high school as well. These are both evidence-based programs and do address the importance of postponing sexual activity in our youth. I will say that in Russell that we have improved our rate from 2015 of 84.5 to 2020 rate at 53.6. So this is very, very encouraging as well. So those are just a few of the things that that I wanted to share with you. Any questions at all on the data? I know that just doing it virtually, it's very, very hard to, like I said before, to digest it. But if you do have any questions, please give me a call here at the health department. I'd be happy to assist you with, what we're working on currently and our future goals as well. Any questions?
Miss Shirley,
Yes, sir.
we've always been well ahead of the curve on teen births. Do we have any idea why? Do we have any handle on that at all? I mean, obviously bringing it down 30% is excellent, or 30 per 1,000 is excellent. But do we have any idea why we're such an outlier from the rest of the state? Is it socioeconomics or what is it? Do we know?
I think that basically we can only have a, maybe just, to me, I have an opinion about it. I think that we still, like a lot of the other surrounding counties, we still need more education. I think one of the big things that would help to improve that would be education as far as at a lower level grade. We do have some excellent programs, of course, as far as RTR and MAD in our middle school and high school, but I really feel like that we need to bring back puberty education in our 4th, 5th, and 6th grade classes. And we used to do that, and but now, not so much. So, this is certainly a great question, Dr. Miles, and I'm not sure that I actually think that there's one particular factor. I think there's a numerous amount of factors. And when we go over the ACEs, especially, I think the ACEs has a big impact on that. Wouldn't you think so, Dr. Miles?
Yeah, I think that is. Dr. Roy and I used to do sex education in the 6th grade,
I
and
remember
the rate
that.
went up 3%. Somebody said we just taught them how to do it, but it went up. I don't know, but yeah, that's why I was asking about socioeconomic factors. The ACEs, but if we could get a handle on that somehow, would be nice, because that's always discouraging, because we've always been well above the state in that level. And I was just wondering if we know any of the factors, and I would assume the ACEs are part of it, but
Yeah,
we tried the education, and be honest, like I said, the rates went up, they didn't go down. But
I agree. And we're not where we used to be. We are moving a little ahead. I think we're progressing, but like I said, I really feel like, personally, being in the classroom, I feel like that we all possible, it would be nice to be able not only to be in the classroom at an earlier grade, but also to maybe even more in the middle school and high school. And we are working on that as far as having more education in those particular grades. So we're working on it. All we can do is continue to address it, and hopefully we'll see some better data coming in the next 5 years. Any other questions? Okay. So again, board members, thank you for the opportunity, of course, for being able to come and share this. I know that we have a lot of departments here in our health department, but you all are very gracious about letting me come and share what health education is doing. And I'd just like to say thank you to the board, and y'all just such a blessing to me, and you all are wonderful community partners, and I appreciate you all so very much. Thank you.
Thank you, Shirley. Judge, I neglected to have Jane do a roll call. We do have a quorum. For the record, Jane, can you announce who's present and who's absent as far as board members?
Yes, I can do a roll call. If you would, do you want me to just go over who I see that is here? Or do you want me to just go through
Yeah,
the
you can
entire
just
list?
announce it since you can see the list of who signed in.
Okay, yes, I can. We have Richard Miles. Dr. Richard Miles is here. Don Cooper, Mickey Garner, Connie Blankenship, Judge Gary Robertson, Karen Dalton, Dr. Von Gruningen, Dr. Suzanne Lee, who has had a name change since our last meeting, and Mickey Garner. And I think Sherry Helm was on the call. I'm not seeing her right now, and she may be back. I'm not sure if she'll be back before we are finished or not.
James
that is-
Popplewell also.
And then there is Dr. Popplewell. I see him now. I skipped him the last time. I'm sorry about that, Dr. Popplewell. Those are the current members that are on the call.
And we need 7 for a quorum, and we have that, so.
Yes, we do.
All right. Judge, the next item's old business. Is there anything that anyone has that we've neglected to follow up on since the last meeting, or anything of old business anyone wants to bring up? Okay, hearing none. And next is new business, setting the tax rate. Judge, I'll move into that if it's okay with you. He says, okay. So I always like to present the budget so you can approve the tax rate in context of the budget. So I'll run through the budget, and then we will, before we approve the budget, we'll set the tax rate. I'm going to share my screen here, but you all have this in your packet. I'll share my screen for the benefit of those watching in on YouTube or who will watch in later. You can see I have the budget pulled up here. This is the budget here in the top block that you approved last year in our regular meeting. It has been updated to reflect our receipts as of December 31st, 2020. And Ron has made some adjustments in the expenses based on what's been processed through the year. But basically, this is the things that you approved. You can see here that we project having at the close of this year a $445,997.13 closing balance. Actually, we'll probably come in somewhat better than that. We don't always spend all of our miscellaneous unknown categories, but that's where we're projecting at the moment. That number that I'm moving my mouse over now ends up getting plugged in down here as our opening balance for next year. So let's see here. I'm going to stop sharing and let a couple more people in the room. Dr. Jones. All righty, and I'll share it back now. All right, so we plug in the closing balance from what we expect to close this year into our expected opening balance for next year. Assuming that you will leave the tax rate where it is, I'm going to present the budget based on the assumption that you keep the tax rate where it is. That's this middle column. If you wanted to do something different, we presented a couple other options there. But at the present tax rate, as far as real property taxes goes, we would project that you would bring in $393,021. Now, how do we arrive at these numbers? Again, this is in your packet. If you'll scroll down, you'll see we've got some calculation sheets here. This calculation is for the present tax rate of 0.045 or 4.56 per $100 of property value. There's a calculation sheet for the other two comparable tax rates. You can see there's three categories: real property, personal property, and motor vehicle. So on those calculation sheets, we pull information from this property value sheet that's sent to all the taxing districts. The county gets this, and the libraries and the school boards. And so we take the appropriate categories from this property value estimation sheet that's forwarded to us from the State Finance and Administration Cabinet. We take the right category, the right amounts from each category, and we plug it into these calculation sheets that you see here in the packet. And then once we get the total for each category, we multiply that by the tax rate, and then we multiply that by a 95% collection rate, and we get the amounts that we plug in on the budget. So I'm gonna scroll back up here to the budget. Sorry if I'm making your head swim by scrolling so fast. But the real property taxes would bring in $393,021.15 at your present tax rate. Personal property taxes would bring in $98,680.62 at the present tax rate. Motor vehicle taxes would bring in $46,641.52 at the present tax rate. We calculate $10,000 in delinquent tax collections, $962.50 in the telecommunication tax, and $282 worth of income from interest. Interest is calculated in this footnote. It says at 0.05% for our checking account. You can see we have a checking account there. When you add up all of the revenues, the total receipts, if we leave the tax rate where it is, would be $549,588. When you add that to the opening balance, it adds up to the total funds available for next year of $995,585.17. Now, what we're going to ask you to spend next year is detailed below that. There's 2.8 cents that every county in the district contributes to our large operational budget, which is mostly staff cost. So most of this comes back to funding the staff in your county. That amount is $352,599. Under the category of building maintenance and repair, we have some standard items: landscaping, maintenance, and snow removal, $3,500. HVAC units, $20,000. And in a moment, Jane or Ron might want to speak about the HVAC situation, but we'll circle back to that in a few moments. Parking lot lighting, 5,000. Replumbing of the drain under the ice maker, 2,500. Tiling the kitchen floor due to flooding from the drain, $2,500. And miscellaneous expenses, $14,000. Now, a few minutes ago, when I was going through our projected opening balance, I said we don't always spend all of the miscellaneous unknown. In each of these categories, we put some miscellaneous funds in case something goes wrong during the year that we don't have line item that gives us a little bit of wiggle room to deal with whatever comes up without having to call another board meeting. When you add up all of those building maintenance and repair categories, it comes up to $47,500. Under the category of furniture and fixtures, seasonal decorations, 1,000, office chairs, 6,000, miscellaneous, 5,000. Now, when I'm putting the budget together, I send an email out to all the employees asking them if they have need of equipment or furniture or repainting or whatever, that they bring that to their office manager. And if their office manager, Jane, in your situation, agrees, they will research the costs and put it in the proposed budget. Under the category of, well, when you add up the total furnitures and fixtures, it's 12,000. Under the category of equipment, miscellaneous computer and related equipment, $8,000. We used to break that out into various categories, but we now just put it in one item, and it encompasses everything computer related, printers or computers or monitors or whatever. If we have need of replacing something, it would fit into that category. And again, if we don't need all that, we won't spend it, but that's there in case we need it. Nurse, clerk, manager, office document scanners, $800. Headsets for the clerks, $600. Maintenance on our generator, $500, and miscellaneous, $5,000. Totaled up for equipment, $14,900. The remaining expenses is we have to have an auditing chair because of the loan that we have on our building. That's $1,500. We have to advertise our financial statements and we have to post our financial statements, advertise our meetings, $300. Board dues for Calbo, putting things on the website for the special taxing districts, KPHA expense, $1,500. Board member meetings, $500. That's usually where we would buy food and stuff for our in-person meeting. We didn't need that this year. Hopefully by this time next year, COVID will be a thing of the past and we'll have an in-person meeting. And then repayment on the loan that we're trying to settle for our building there. The total payments will be $157,772.76. When you add those miscellaneous expenses together, it's $588,571.76. That's all of the categories together. That's the total expenditures. You can see that the total amount, once you take the funds available from what we expect to spend, is $407,013, which is a $38,000 deficit for the year. However, if you will look down a few pages here, again, excuse me for scrolling so quickly. At your present tax rate for Russell County, you can see that over the past few years, 1, 2, 3, 4 years, at your present tax rate, where we haven't spent all the miscellaneous unknown, you've been coming in above a deficit. So I think your present tax rate is sufficient, even though we're projecting at a deficit. We probably won't spend all that miscellaneous unknown, and it looks like you are okay. Let me scroll back up to where we were. I did include here on this sheet, this is the schedule of repayment on the building. This is what we'll be spending next year in the monthly payments. And you can see that we're projecting to pay off the building in October of 2030. So we have about, roughly 10 some odd years left on our building to settle our building loan. So again, this is to kind of put the tax rate in perspective, but as we've gone through the budget, if any of you all have questions about anything that we've presented, it would be a good time to ask. Jane, you might mention about the HVAC units since that's a fairly large line item.
I have one HVAC unit outside that is currently showing signs of, it hasn't quit yet, but it is currently freezing up on a regular basis. So I'm expecting it to go out. I'm hoping it'll last, but I'm looking for it to need to be replaced sooner than later. So that's just an expense that I'm projecting, that I'm looking at soon. There is one more in our building that gave us a lot of trouble this past summer. That's not the one that is freezing up, that I'm afraid that is probably going to need also possibly need to be replaced. So I'm going ahead and putting those in the budget so that possibly the miscellaneous funds will not be completely used up on the HVAC units, and us be left with not having any emergency funds in the event that those two units are on their last legs like I expect them to be. They are the two, I think maybe the only two remaining units that haven't been replaced since the building has been put in. So that's
HVAC units don't last as long as they used to.
Yeah. So I'm just not expecting them to, I'm not expecting them to go another year, to be honest with you. Like I said, they haven't been replaced yet, and they're showing signs of not lasting the rest of the year.
Does anyone have any questions about anything in the budget? Again, we're not ready to approve the budget. We're to the tax rate, but since we've presented it, do you have any other questions about it? All right, Judge, if it's okay, can we consider the tax rate? You're muted, Judge.
Need a motion to accept the tax rate. I assume it'd still be the same rate we had last.
Let me make one statement. There was a law that passed this previous session that it appears now that the health boards are going to be subject to the compensating tax rate. However, the Cabinet for Health and Families has taken the position that that law doesn't apply to the health departments, and the Department of Local Government has taken the position that it does. So I don't know who's going to win that, but whenever you make your motion, if you're going to leave the tax rate the same, I would say we make a motion to keep the tax rate at 4.5 cents per $100 of property value, or to accept the compensating tax rate, whichever one applies to us. As I understand the compensating tax rate, it keeps your raw number of dollars equal to the previous year, regardless of changes in property value, unless you specifically want to raise it. So either we would keep it at the 4.56 per $100, or for now, we would take the compensating tax rate. And hopefully next year it'll be clearer which set of rules we're under.
I would make a motion, this is Dr. Miles, I would make a motion, we could keep the tax rate at the same rate as long as it's considered legal. We accept the compensating if they make that change. I think looking at that, we're still one of the highest too, as far as our tax rate, even though we're showing a bit of a deficit, but we always come out ahead. So I vote we keep the tax rate the same, and then if they change that law, then we'll go with the compensating rate.
All right, that was a motion from Dr. Miles.
Don Cooper seconds. Hear me.
All right. And this would be where there's discussion. Judge, if it's okay, we'll take a vote. You're muted, Judge.
All in favor by saying aye.
Aye.
One opposed. Motion passes.
All right. Considering you passed the tax rate, I would go ahead and propose that you approve the budget as presented.
Mickey Garner, I approve the budget.
Mickey made a motion to approve the budget, Jane.
I'll second that motion.
That was Dr. Stephanie Jones?
Yes.
Yes, all right. This would be where there's discussion. Judge, I hear no discussion. If you want to take a vote.
All in favor, say aye.
Aye.
Anyone opposed?
All right, Judge, under the next item, it's listed that the members whose terms are going to expire, Dr. Miles, Holly Von Gruigen, did I get close to getting that right?
Yes.
How close?
Von Gruenigen, you're close.
All right, thank you for the grace. Mickey Garner, Sherry Helms, Stephanie Jones, and H. James Popplewell. Usually we have you all fill out a paper version of the nomination form and resubmit you to the state to be appointed again, as long as an electronic nomination form. So I will fill those out on behalf of you on the state's website and submit them unless there's someone that just doesn't want to serve again. Now, if I don't hear you say you don't want to, I'm assuming you do, and I'm going to fill that paperwork out for you and submit it. There's nothing to vote on that since the board appoints everyone other than the judge is automatically on it. And then the fiscal court appoints an additional member, but all the rest are appointed by the Commissioner of Public Health out of his office. So I'll submit those nominations on your behalf. The members who serve on the district board are right now it's Dr. Miles, and of course the judge is automatically on the district board, and Dr. Lee, Dr. Suzanne Lee, who has name changed since last year, she serves on the district board. So right now, of course, all of our board meetings, we on our district board, we generally meet 4 times a year, and right now we're doing it by way of Zoom. So at least the travel burden's not too bad. Generally, when we had them live, they were there in Russell County, so that's not too terribly much of a burden, even when we do them live for you guys in Russell. It's a travel burden for some of the outlying counties.
This is Sean. I'm more than happy to continue. If any of the younger docs or anybody else wants to take my place, I'll be happy to step down too. It's whatever. I mean, I don't mind, but I don't want to stand in the younger person's way, but I'm happy with serving there. So.
Thank you, Dr. Miles. You always have really good insights at the board meeting.
Sean, I had, I don't mind, this is Dr. Lee, I don't mind serving as well. I know I have for many years because I was the only optometrist on the district board and we're required to have one. But I do know that Dr. McKinley from our group is serving now also from McQuarrie, I guess it is. And so if, if someone else would like to serve, I don't care to step aside to that, but I don't mind to continue if need be.
Appreciate that. And of course, the judge is automatically on it. So you guys
I
just
think Dr. Miles and Dr. Lee have done a great job.
Was that a motion?
Yes, I'll make a motion to keep the district board members the same.
That was Stephanie Jones.
Mickey Garner, second it.
The opportunity for discussion. Judge, do you want to call for a vote?
Really?
All in favor?
Went to Russell Springs quicker than they got this over with.
You're muted, Judge.
Everyone in favor of keeping the district board the same, say aye.
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 Anyone opposed? Okay, motion passes.
All right, Judge, I'm going to move on to the audit, if that's all right.
Okay.
I'm going to pull that up on the screen. Again, this was in everyone's packet. You see we have the audit here in the packet. I'm just going to scroll down. You've got the full audit report, but the part that's important to read, there's two parts here that is the most important. There's two statements here in the center of your screen. One's that they always list, every auditor lists, is there's an adverse opinion about the way we account our accounting. We use a cash accounting system. That's the requirement of state law. Most people use accrual accounting, but by state law we use cash accounting. So they always note that we're using an obsolete accounting practice. But again, that's what state law requires us to provide. However, they list an unmodified opinion below that, saying that our financial records reflect fairly in all material respects our assets, our liabilities, and our balances. So in other words, it was a clean audit. So that is something we do need approval, motion in a second, and approval accepting the audit report.
Don Cooper, makes the motion to accept the report.
I'll second that.
That was Dr. Lee.
Yes.
And Judge, you can unmute and call for a vote. You're still muted.
Got a motion and a second to accept the audit report. All in favor by saying aye.
Aye.
Anyone opposed? Motion passes.
All right, Judge, the next thing is the comments from the director. So my life has been all things COVID-19 since March. And we've rolled most of our health department staff at some point into our response. Our response has, of course, evolved. We were mostly doing case investigations, contact tracing, public health education, and then we got into some of the enforcement of the guidance. And now we're moving into, of course, there was a lot of consultation with businesses and nursing homes and things about safety plans and prevention plans. And now we've gotten more into the vaccine phase. As of today, we're scheduling 4,000 appointments across our district. Hopefully by the end of the day, we'll have all those scheduled. There are some more, right now, Lake Carmel Regional Hospital is a regional hub, and there are supposed to be a couple more regional hubs opening up in our district in the next 2 to 3 weeks, probably. And then there's several pharmacies in our district that's going to start getting some vaccine directly from the federal government. I think we'll post that on our website tonight, the list of those pharmacies that'll be getting that push. So they're starting to get to be a little bit more vaccine available. We're still in the 1A and 1B, which is, school staff, medical providers, first responders, and those 70 and older. Mostly we're focusing on 70 and older right now, and that's going to probably take a few more weeks to get through that group. I'd be happy if the next group was the 60 and older, but I don't know what the governor will decide. For the 70 and older, that represents 50% of our deaths and 75% of our hospitalizations. So that's an important group. If you add the 60 and older, that's 75% of our deaths and about 90% of our hospitalizations. So if we could get on into the 60 and over after we get to the 70 and over, that's my logic of why I would like to push that group next. But we'll see. I mean, that's up to the governor and the commissioner, and they'll tell us what phase we'll be in after we get through the 70-year-olds. People ask me, when will we be done with the 70 group and go on to the next group? Well, we'll be done when the demand stops. And, when we have vaccine and we can't schedule appointments for it with that group, we'll start opening up to the next group. And my guess is that'll be still a little while, a few more weeks. We'll know a little bit more by the end of the day. I expect that, we've got 30 phone lines right now pushing towards scheduling and 20 operators, and they've not stopped taking calls since we opened the phone lines. We're certainly the phone lines, our phone system is overwhelmed. We've had hundreds of thousands of dial-ins this morning trying to get through those 30 phone lines. And by the end of the day, I hope we have all 4,000 appointments. Sometimes people ask me why we're not keeping a waiting list. At the health department, we've not been promised a recurring supply of vaccine. And I hate to put people on a waiting list and give them false hope when there's other sites in the state and other sites opening up that they might go to. And I know several people have gone out of our district to get the vaccine, and maybe they wouldn't have gone if they were on a waiting list that we had no promise of vaccine. If at some point the commissioner promises us a recurring supply of vaccine, we may rethink that. But for now, that's what we're doing. The phone system, phone scheduling is, it's overwhelming. There's a lot more people that want it than there is vaccine, and people get frustrated that they call in and, get a busy signal. But, the 70 and older population that we're targeting has told us they prefer to speak with someone on the phone. They're not comfortable with the online scheduling and things. So I don't know a better way to do it. There's no good way to spread, a few doses across a lot of people. It's just a challenge. It will get better though. With this 4,000 dose push that we got, we may be getting close to being over halfway through our 70 population. So it should, if we can get more pushes, we should, be getting really deep into that market. So that's kind of where we are with those things. I'd be glad to answer any COVID questions you have. The last 3 or 4 weeks, cases had been going down, our new case rate for our district. This week it went up a little bit. I hope that was a fluke and it's not starting to spike again.
Yeah, I think
time will tell about that. Our district, we're still doing the case investigations and the contact tracing. Some health departments had to abandon contact tracing because it got too much demand, more than they could bear. We've been able to fortunately continue to do the contact tracing too, which is important, getting people who've been exposed quarantined so they don't, if they convert to being positive, they won't infect other people. So with this virus, if you have to identify people who's been exposed very quickly, because they will become infectious within just a few days. And sometimes by the time we get the lab report, they're getting really close to being in the infection phase. And so we have to turn that around. Of course, all that's an effort to keep the spread of the disease slowed down until the vaccine can be pushed out. And of course, now we're getting vaccines. So hopefully all of that hard work has paid off. Kentucky's kind of a middle of the road state. What I mean by that is they're not nearly as restrictive as some states. But they're not as, they're not a free for all as far as no restrictions either. We're really kind of in the middle of the road, and we're really kind of getting middle of the road results. If you look at any of the trend charts, Kentucky's kind of right in the middle of everything, cases and deaths and hospitalizations and so forth. So we're kind of getting, taking a middle ground approach and getting middle ground results. I don't know politically whether you agree with that or not. That's just the way it is. So if anybody has any questions for me, I'd be glad to try to answer.
Sean, I've got two. This Dr. Miles. First one is, do we have any idea how efficient we are as far as getting the number of doses out that the state has received? I know our health department is going to be efficient, but I'm talking about statewide. How many doses have been wasted? Are we very efficient with that?
No, I really haven't heard of any wasted doses, though there surely has been a few along the way, but we're all being really cautious with it. We know it's very precious. It's a complex. They come in vials of 10 doses. Once you stick the vial, you have 6 hours to use it. So you have to be kind of it's kind of tricky. And the handling of this vaccine, you can't really shake it and stuff. And so it's kind of hard to handle and hard to transport and things, but it's very effective. After you get your boost dose, it's like somewhere between 90 and 95% effective, even with these new mutations of the strains you hear about. The vaccine still is proving to be effective against the new strains, which the new strains, they're more aggressive in spreading, but the vaccine seems to be working against those too. Of course, we're kind of up against the clock. Vaccines want to mutate, or not vaccines, viruses. They want to mutate. They want to survive. So the quicker we can get people vaccinated and get a handle on this, the better. We'd like to get it done before the thing mutates to the point that the vaccine becomes ineffective. So we will see. It's a constant battle.
Sean, I've got a question. This is Mickey Garner. How many vaccinations did we get for Russell County? I know it said 4,000 for the district, but how's that divided up, and how many did Russell County get?
Let me pull that up, Judge. I had a meeting with all the county judges a few days ago to talk about how we were going to distribute that vaccine.
Russell has,
vaccine to our district office so that we can divide it up more equitably. Some of the counties was complaining that, like a county like Cumberland, if they're getting 100 doses at a time, they're going to work through their 70 and older way faster than a county like Pulaski. So now they're shipping it to the district and we divide it up. But let's see, Russell is getting pushes of, you all are actually getting 100 doses for each push. So we got 4,000 doses. So you will get 400 of those.
Okay, how's that done by population, or how's that done?
That's correct. It's ratioed out by population.
Okay.
Some counties get less than that, and some counties get more. It depends on your population size. But again, I went over that with the county judges the other day. I wanted them to understand my logic. As a district department director, I've always tried real hard to spread things out based on the population size of each county, so that every county was getting proportionally its fair share. And just now, as the circumstances changed to where I have some say over that. Up until now, the decisions to push it's been made someplace else. And how much we're getting is still being made someplace else, but they're shipping it to me and letting me subdivide it. So, we want to try to keep all of our counties
From
sort of
120 days to 60
as best
days.
we can.
Moderna has.
Did somebody have another question?
Only reason I asked that question is when you put that like 4,000 doses on as district, even though it's not exact, it is district, but people in the county think, well, you got 4,000 doses to give out in Russell County. If we could, or if the county judge here, Russell County judge, could announce that Russell County Health Department's got 400 doses and not 4,000. I mean, I just think that would help the people in the county. It wouldn't put as much pressure, maybe not only on Russell County, but every county, if they could announce that the health department's going to have 400 doses. People would more understand than they would that, there's 4,000 doses there. That's just a question.
Yeah. By the way, all the counties in the state have a mutual agreement that we won't turn anyone in state away. And you may think that, well, that don't sound right, that, somebody might travel into our district and get a Russell County dose. But, we've had a lot more people going out and getting it than we've had people coming in and getting it. So it's a net to our benefit to have those agreements. Because, we've got Lake Cumberland Regional that's getting the 500 weekly doses. It's where advantage other counties are turning away. Any more questions about that? Well, COVID's been a real challenge. I can tell you it's been hard. I thought being fussed at about these restrictions was painful. It's nothing compared to the pain of talking to all these people each day that don't get an appointment, that are desperate and want an appointment. You know, you can only make doses go so far, and not everyone's able to get one. And, you know, you make, like when we got that push of 700, you know, we made 700 people happy, and, you know, 9,300 people thought we were morons. And some of those 9,300 will reach out to you and tell you what a moron you are for not being able to spread 700 doses farther. So, and, you know, my heart goes out to everyone that calls me. They have, you know, a very good story about why they need it. But, you know, I can't make any one person any more important than the next person that's also in that high priority category. Now, to you, if you're calling me about a family member, to you, that family member is the most important thing in your world. And I get that. But all 10,000 of those people in that category are important from my perspective. And I just try to make sure we have a fair way everyone has an equal chance of getting it. So that's what we're doing with the call in. We started at 9 Eastern and 8 Central, so both time zones have an equal shot to get in on the phone lines. And, you know, it's the way it rolls. It'll get better. We'll get through these 70-year-olds in a few weeks. It'll get better. It's a lot of pain and suffering between now and then, though. A lot of frustration with people, and I get it. Judge, I don't have, well, we have election of officers. We do have one other item. Let me, your officers right now, Judge, you're the chair, and the vice chair is Don Cooper, and your treasurer is Karen Dalton.
If they're willing to serve, I make a motion, same officers.
I second it.
That was Rick Niles and Mickey Garner, Jane.
Got a motion for the same officers for the next year, and a second by Mickey Garner. All in favor by saying aye. Anyone opposed? Okay, we have the same slate of officers the coming year.
All right, Judge, nothing left but to adjourn.
Do I hear a motion, we adjourn?
I'll make a motion.
Motion by Mickey Garner. Got a second?
I'll second it.
Second by Dr. Jones. All in favor by saying aye. Thank you all. Appreciate it.
Thank you all. I hope to see you live next year. Bye-bye.
Thank you, John.